Hello everyone. Uh, Today we will start with the topic of prenatal testing and diagnosis, which is included in the syllabus of genetics. So, what do we mean by prenatal testing and diagnosis? Prenatal test or diagnosis are the investigations or the diagnostic evaluation techniques which we used to do in a pregnant lady or during the antenatal period of a woman. Antenatal period refers to the pregnancy period when it is the duration when woman conceives till the birth of the baby. So to rule out few genetic abnormalities or chromosomal abnormalities, we used to do prenatal testing and diagnosis. So, coming to the definition, prenatal diagnosis are the procedures undertaken to diagnose genetic abnormalities and structural anomalies, often early in the embryo stage and in the fetus, in order to undertake timely prenatal counseling and appropriate interventions, and it also allows timely termination of pregnancy, thereby preventing wastage and perinatal mortality. So as I have already told you that prenatal diagnosis we used to do in antenatal period to rule out few of the genetic and structural anomalies in the fetus, which we can take timely prevention or treatment. For some conditions we can go for prenatal counseling and we can take appropriate interventions before the birth of the baby. Or if the genetic defect or the chromosomal defect is very much severe, we can go for termination of the pregnancy. By definitely we have to of course discuss with the parents or the couple. Now, for what conditions we have to go for prenatal diagnosis? Usually, we used to go for prenatal diagnosis in all the antenatal mothers, but there are some indications for which we have to do prenatal investigations definitely in that mother. So, the first indication is advanced maternal age. Advanced maternal age refers to the age of the mother. If it is 35 years or more than 35 years, we have to go for prenatal diagnosis. The second one is previous child with a chromosome abnormality. So you know that there are some chromosomes in our body, 46 pairs, 46 number of chromosomes, 23 pairs. So, if there is any chromosomal abnormality, like for example Down syndrome, Klinefelter syndrome, Turner syndrome, etc., if there is any previous baby with such type of conditions, we have to go for a prenatal testing. The third one is women who are pregnant with multiples. So, if the pregnant woman is seen to be having twin pregnancy or multiple pregnancy, or twins or more like triplets or quadruplets, we have to do prenatal diagnosis in that lady. Fourth one is family history of single gene disorder. So while doing the history, while evaluating the couple or the lady, we have to take a history whether if there is any presence of genetic disorder in the family, then definitely we have to go for the prenatal testing. The fifth one is family history of a neural tube defect. Neural tube defect is a abnormality in the spinal cord of the embryo or the fetus during the developmental stage inside the mother's womb. So if there is any family history of a baby with a neural tube defect, then we have to definitely go for prenatal diagnosis. Next is family history of other congenital structural abnormalities. There are various congenital abnormalities which we will be discussing in our next explanations. So congenital structural abnormalities, I will give some of the examples like neural tube defect, anencephaly, encephalocele. So if there is any family history of these conditions, we have to definitely go for the prenatal testing in the mother. Then abnormalities identified in pregnancy. So if the mother is having any high risk pregnancy like gestational diabetes mellitus, if the mother is having diabetes all throughout the pregnancy, if she is having hypertension all throughout the pregnancy, if she is having any thyroid disorder, if she is having anemia, then we have to go for a prenatal diagnosis so that we can rule out whether these conditions has affected the fetus or not. Then women who had previously who have had previous miscarriages. If the woman has previous miscarriages, then also we have to go for the prenatal testing. And other high risk factors like consanguinity, poor obstetrical history, and maternal illnesses. Consanguinity means if the mother, there is a close blood relation with the mother and the father, whether it is first degree or second degree or third degree, and if there is any poor obstetrical history in the earlier babies, and if there is any other comorbid maternal illnesses, then in these conditions we have to definitely go for prenatal diagnosis in the woman. Next are the methods of prenatal diagnosis. Now we used to go for two methods. The first one is invasive and non-invasive. So you know that invasive means which enters the body, and non-invasive means it doesn't enter the body. So under invasive techniques, the procedures are amniocentesis, chordocentesis, chorionic villus sampling or CVS, biopsy from fetal tissue, and colocentesis. And under non-invasive techniques, there are ultrasonography, MRI or magnetic resonance imaging, cell-free fetal DNA, and triple test. So normally we used to go for ultrasonography, triple test, and sometimes amniocentesis. So before going to amniocentesis or chorionic villus sampling, you have to know what is amnion and what is chorion. So I would like to give you an assignment, or you just go through what is amnion and what is chorion in this regard. Now this is about amniocentesis. So amnion is the as you have seen in the picture, this amniocentesis, it is performed in the second trimester. Normally in the whole pregnancy period, we used to divide the whole antenatal period in three trimesters. First trimester, second trimester, and third trimester. First 3 months are referred to first trimester, second 3 months are referred to second trimester, and the third 3 months are referred to third trimester. So this amniocentesis is done in the second trimester. That means either in the 4th month, 5th month, or 6th month of pregnancy, and it is done one in 300 to 500 pregnant women. So there is a chance of miscarriage in amniocentesis. So here what they used to do, they used to insert a needle in the amniotic sac, where the baby is butted in the amniotic sac. So they used to insert a needle, and then they used to extract the amniotic fluid for investigation or evaluation. Next is chorionic villus sampling. So it is also performed in the second trimester, and it is a specialized technique. It should be done only by the obstetrician, and the risk is same as amniocentesis, as it may lead to miscarriage. So here needle is inserted in the chorionic membrane, and a little amount of villus is extracted for examination. Then come to chordocentesis. It is also known as PUBS. That means it is uterine, pre-uterine. Okay, I will let you know the full terminology of PUBS. It is done after 18 weeks of pregnancy. So it is also done in the second trimester, and it is done in 2 in every 100 women, and there is a risk of miscarriage. It is not done in general. Next is fetal tissue biopsy. So in some conditions we used to go for fetal tissue biopsy. I guess you know the meaning of biopsy. Now this fetal tissue biopsy is extraction of the fetal tissue by the same methods as amniocentesis or chorionic villus sampling. So here it is performed between 17 to 20 weeks of gestation, same as in second trimester, and less than 1 in 1000 women shows infection. This is the commonest technique which we used to perform in a pregnant lady, that is ultrasonography. So here medical imaging technique that uses high frequency sound waves, and the frequency range between 1 to 12 megahertz, and developing embryo can be visualized at about 6 weeks of gestation. That means in the first trimester itself we can rule it out whether the mother has conceived or not, or if there is any chromosomal abnormality in the mother. Triple test also it is done quite often nowadays. So it is also known as double test or quadruple test. So triple test is actually it is the combination of three tests, that is alpha fetoprotein, human chorionic gonadotropin, and unconjugated estriol. So this three test combines the triple test. Triple test screens for the following fetal disorders. So there is a table you can see. So in this table, this triple we used to do this triple test to screen for few of the fetal disorders. So the disorders are in the first column is open NTD, that means open neural tube defect. So the maternal serum alpha fetoprotein is increased in open neural tube defect. Estriol, in estriol level there is no change. Beta chorionic, human chorionic gonadotropin also doesn't change in open neural tube disorders, and inhibin A also it remains the same in case of open neural tube disorders. So we can see that only alpha fetoprotein is raised. In Down syndrome, the maternal serum alpha fetoprotein is decreased. The estriol level also it is decreased, but the beta human chorionic gonadotropin level is increased and inhibin A is increased. In trisomy 18, this is also a chromosomal abnormality. The maternal serum alpha fetoprotein is decreased, the estriol is decreased. In beta human chorionic gonadotropin it remains the same, and inhibin A also it remains the same. So by this quadruple test we can rule out the few of the genetic disorders. Now what is the application of prenatal diagnosis? Maternal serum screening, that is it is the combination of three tests, that is fetoprotein, estriol, and human chorionic gonadotropin estimation. Ultrasonography is done to rule out the structural abnormalities in the fetus. In amniocentesis, we can take the sample of fetoprotein and acetylcholinesterase. Chromosomal analysis can be done and biochemical analysis can be done. In chorionic villus sampling, we can do the DNA analysis of the baby or the fetus, chromosomal analysis and biochemical analysis. In fetal blood sampling, we can also do the chromosomal analysis and DNA analysis of the fetus. So by this we have come to the end of the prenatal test and diagnosis. So for a review, you can just see that what are the indications of prenatal test, in which type of mother we can do the prenatal testing. Like first one is advanced maternal age, the second one is if there is any family history of genetic defect or chromosomal defect, if the mother is having any other risk factors like poor obstetrical history, then if the mother is carrying twins or triplets, and if there is any other comorbid maternal illnesses, then those ladies can be referred to prenatal testing. And there are various invasive and non-invasive methods. The main invasive methods are amniocentesis, chordocentesis, human chorionic gonadotropic sampling, chordocentesis. And in the non-invasive methods, there are ultrasonography, MRI, and any other techniques are there. So triple test is there, quadruple test is there. So mainly nowadays the mothers, they used to go for ultrasonography, triple test and quadruple test to rule out the chromosomal and structural abnormalities in the newborn. I hope you have got the points, and if you have any doubt, you can just text me out. Thank you so much.